Dr. Vijay Bhaskar, orthopedic surgeon, masters, where commonest problem in the human body is largest, highest activity in our body is knee. The knee pain is in most of the people after the age of 45 usually complain about the pain, swelling and deformity. So the diabetics, where this sort of a knee pain is very common because of it's a chronic disease where leads to certain nutritional imbalance and then sometimes a wear and tear of the joint, and there is a susceptible to many infections as well as bony diseases. So the diabetics need to be controlled very well. The blood glucose level should be controlled very well so that the chronic problems will not lead to damage to organs and then important joints like knee. The knee is the most mobile joint in our body, which a hinge type of joint, which has a lot of important bony ends like femur, lower end and then upper end of tibia, connected with collateral ligaments on either of sides, a crucial ligaments inside where anterior and posterior movement will be maintained, and then there is a cartilage tissue called menisci. So obviously in diabetics, when the sugars are not controlled, then there is a possibility of source of infection will lead to septic arthritis of the knee, sometimes tuberculosis of arthritis of knee, and then rheumatoid arthritis of knee and various arthritis of knee. When there is a injury or fracture to the knee, when the diabetes is not under control, then there is a much possibility of bacterial infection or non-union malunion of the fracture. If there is a synovial inflammation, then if the diabetes is not controlled, it will lead to synovitis problem, further leads to degenerative osteoarthritis of the joint. So knee is the most important part of our life, where it should be well strengthened to maintain our physical activity. So diabetics and knee pains are more often developed because of diabetic neuropathy, diabetic arthritis and various other causes. Like in diabetes, the fluid which is lubricating in the joint becomes turbid or thick, so that the joint goes into stiffness and then pain to the part. So the diabetic people should take care of their knee by doing regular exercises like swimming, cycling or treadmill, walking and aerobic exercises, so that the joint is well maintained. If there is any problem like pain, swelling and deformity, we should diagnose with the MRI, CT and X-rays and basic blood tests to rule out the cause and then treat accordingly.